Did you know you could be swallowing up to 90% of your asthma medication? Good day, I'm Dr. Tia, and today I am showing you how you could reduce that by using a spacer device. A spacer, which is this bit, is a medical device that assists in the delivery and efficiency of your asthma medication. This means a lot less of your medication ends up in the gastrointestinal or the digestive system, as this box illustrates right there. So if you are using the medication on its own without a spacer, which is just delivering it like that, chances are a lot of it is ending up in your stomach than in your lungs. But by using the spacer, you get better delivery of the medication into your respiratory system. How do you use a spacer, I hear you ask? So a spacer, this device, you get from the pharmacy, and it has two ends. The area where you insert your metered dose inhaler, so this is either a salbutamol, like a Ventolin like this one, or if you have a steroid, Seretide, Flixotide, your medical practitioner will guide you on how you manage that. So before we use it, we have to figure out, is it a clean spacer? So if it's a sterile spacer, because you just bought it from the pharmacy, or you've washed it, then we have to prime the spacer. That involves one punch, 1, 2, just to coat the inside of the spacer. The washing process, which if you're just using it with a Ventolin, should be once a month, warm soapy water, air dried on the sink, assemble and prime. But if you're using any of those steroid medication, once every fortnight, warm soapy water, air dry on the sink, and assemble and prime. So you always prime if the spacer is sterile or if it is clean, okay? So this is the end where you put your medication. This is the mouthpiece, and you would seal your lips completely over there, over the mouthpiece. If you have a baby or a toddler, they are not going to consistently be sealing their lips over the mouthpiece. So you would use this, which is a mask that you would put at the end there to cover their nose and mouth. So there are different sizes of this based on the age of the baby or the toddler or the kid. And it's just because they are not going to consistently have their lips sealing the mouth end part of the spacer. Okay, so I'm going to take this off so I can talk you through how to actually take your dose. So to prime it, as I said, you do 2 puffs. That is for just the spacer. And you make sure that you don't dry the spacer inside, because that can increase the static inside the spacer. This particular brand is anti-static, but I still recommend that you don't dry the inside, just air dry it on the kitchen bench. Okay, so you're ready to get your dose. So what you do is you shake this. I'll talk you through it. So you shake it, you put it there, 1 activation, and you have your lips sealed here, and you take 4 even breaths without moving your mouth away. So your mouth stays in here. There are valves in the spacer that manage the delivery of your medication into your lungs. Okay, so I'll take a dose and show you how you take it. So shake. So that's how you would take 1 dose. Based on your asthma action plan, which you would have curated with your doctor, it tells you how many of these doses you need to be taking. So each one you shake, put it in, 1 punch, 4 breaths. Shake, put it in, 1 punch, 4 breaths. In that way, you are having less medication ending up in your stomach and actually ending up where it needs to be. A lot of patients come into my consult room saying, my medication doesn't work, because they've been prescribed these medications and they didn't know how to take it. I explain it to all patients, and when you come for your annual asthma action plan review, I make sure that we are still on the same page on how to actually take medication with a spacer. So hopefully you have a spacer. If not, you get one from the pharmacy, and they come in different sizes, and you can have one that telescopes in so that it can fit in your backpack for school, or in your work bag, or anything like that, in your nappy bag. It just helps in the delivery of the medication, which is important, because otherwise, what's the point of having medicine if you're just going to be swallowing it? It's not even acting where it should be. Hope that was helpful. Until next time, see you later.